For the longest, doctors have been telling me, it's not gonna happen, it's not gonna happen, it's not gonna happen.
I took this pregnancy test and it was the faintest little positive.
The pregnancy went normal up until about the end of month 5.
But that's when I started to really recognize that there was something really wrong with my body.
And they're like, you have COVID.
I woke up and I was bleeding as if it was a period. And then I started having contractions. And I was 23 weeks.
But while they were prepping me for the C-section, they were putting me on the ventilator. Like everything went downhill from there. Like I was going into respiratory failure. My kidneys were shutting down, and I was going into cardiac arrest.
I also don't know if my daughter's alive at this point.
I'm Morgana. I'm a humanitarian, photographer, and filmmaker. And this is my husband, Jaco. He's a helicopter pilot. In 2014, we were living in Liberia, West Africa, when the world's largest Ebola outbreak erupted. I helped PCI Media share Ebola survivor stories through radio, TV, and social media, reaching nearly 10 million people. It helped curb the spread of the virus by driving changes in attitudes and behaviors. I saw the impact the storytelling had on communities in the middle of the outbreak. So when COVID-19 started spreading where we lived in 2020, we began documenting and sharing stories of COVID-19 survivors in New York to spread awareness about the disease. But we decided that wasn't enough. We wanted to show how COVID-19 is impacting people across America. So we moved out of our New York apartment and we moved into a 19-foot trailer so we could document COVID-19 survivors in all 50 states in America.
When I came out of the coma, they don't tell you that the drugs that they give you are so heavy. I had a hard time distinguishing between reality and fiction. I just remember nobody ever telling me that when you die, aliens come and take you. Because when I went under, you didn't have to be in full PPE and stuff like that. So when I came out, everybody's got on full PPE, and it's just like, okay, they've got on, they've got on the headscarf, they've got on the gowns, the mask, everything, the little booties, everything. So it's just very, very strange. And I'm just like, okay, so I've died. But it was just like, nobody ever told me you get abducted by aliens.
I mean, when you went into a coma was right as the pandemic was blowing up in the United States. And so people weren't wearing PPE, they weren't wearing masks, they weren't really doing anything. How long were you in a coma?
33 days.
So you wake up a month later and the world was a completely different place.
Yes.
Completely. I can't imagine that in a way culture shock. I mean, of course you thought you were being abducted by aliens. That's not shocking at all.
Once we got past the alien thing, and I guess I'm like awake now, like I guess at this point my eyes are open. And I'm looking at this nurse, but she's like full PPE and everything like that, and she's holding up a picture, and she's like, this is your baby, this is your baby. I'm just like, oh, okay. Everybody was like, oh, congratulations on your baby, congratulations on your baby. I'm like, what baby? I didn't even realize that I had a baby. But it's like, I've still got like a bunch of tubes and stuff, so it's like I can't really talk, but it's just like I don't have a kid. A couple days later, they let me talk to my mom. And I asked her, I was like, they said I had a baby. She was like, you did. She was just like, you had a little girl. She was like, you don't remember being pregnant? No. It took about like a week and a half for everything to like click and all the pieces to come back together. And then going through like my phone and looking through pictures and like my social media and stuff like that, and it was just like, oh, okay, well, I wrote this, so clearly it had to have happened. But even then, it still didn't seem real, because I remember scrolling through my social media and seeing, all the people that had passed, and I'm like, this just can't be reality. I had just seen a cousin of mine before I went to the hospital, and it just happened to be the same week that I went into labor. He had passed 3 days later on the vent. He'd only been on the vent like a week, and he had passed from COVID. It still made it hard for me to be like, okay, well, is this something that I'm imagining, or is this really happening? You know, you figure, you know, having a baby, that should be the most amazing moments of your life or whatever like that. You should, but it was just like, I just didn't remember it. So sometimes I feel a slight disassociation from it, but you know, that doesn't mean that I don't love her. That's my little pride and joy. That's my little honey bear. I couldn't imagine this life without her. You know, I just wish I had, you know, those moments that, you know, cemented in my head, but sometimes they still feel like a blur.
We got to 25 weeks, and that was huge. Then we got to 25 and 1. Everything happened so fast. Mason was born. She went away, and Dr. Holbrook looked at me and he said, he was like, I'm so sorry, but I'm gonna tell you that you need to go to an emergency DNC right now. And by that point we realized how much I was bleeding. And he said, if we don't do the DNC right away, we might have to do blood transfusions and you might get an infection in your blood, because he was like, I don't know what happened with all this, but something's not right. The whole thing felt so traumatic and I started to panic. I also don't know if my daughter's alive at this point.
So after we clamped and cut the cord, they took Mason over to the warmer. She was pretty floppy, they noted, and not breathing super well. So they did all their normal things they do, gave her a little bit of oxygen in the nose, stimulated her and everything. And she didn't perk up the way that they expected. It seems like there probably was an infection that was brewing in there that we hadn't seen signs of yet, but overall not a particularly abnormal delivery. At 25 weeks with a female fetus that weighed 600 and something grams, which Mason weighed, and got steroids beforehand, the chance of survival is about 80% almost. Based on everything we saw after delivery, I really thought Mason was going to do very, very well.
I'm a staff nurse, work on the floor, I work as a charge nurse. I'm also a member of our neonatal transport team. I think with every NICU patient, unlike other units in the hospital, we are part of their family. We're there for lots of milestones, especially with a baby that's born that prematurely. So we get to know the families, we get to know the patients. We always joke about how they're our babies, but yeah, we share the struggles. When Leah was well enough, feeling up to coming over, I got to meet her then when she came over to meet Mason for the first time. I remember standing on opposite sides of the isolette with Leah and sort of introducing her to Mason and introducing her to the equipment that was helping support Mason at that time. Not unlike other premature babies, she was on respiratory support.
Mason started life so strong. Most days she was super active, super wiggly, super expressive, even before she figured out vocal cords. She just was happy. Like 98% of the time, she was super happy. And when she wasn't happy with something, like, it was just so explicitly clear. And, she was a very good communicator. She would always let everyone know how she felt. But I had no doubt in my mind back then that she was going to be fine. I was 100% confident that she was going to beat all the odds and be okay. And yeah, she would have. She would have been if she could overcome the gas exchange issue.
I thought that was so adorable.
Oh, that is. So it's like a professional shot.
And this is her very first one. She was fresh out. And it was like, she looks huge, but she's so tiny. It's my absolute favorite. They got this little bitty hat on her. She was adorable. They were sent to me because I didn't take them. I was still in the hospital myself. Here it is. This is the one right here. When they took this in the hospital. You can see her little tubes and stuff. Look how tiny her little legs and stuff were. Little tubes. I love that little hat. I got this in her little memory box. It's her first little onesie. It's so tiny compared to her little clothes now. And even they were falling off of her. She was due May 23rd. She came March 23rd. She was born COVID positive. She had some breathing issues and some light kidney issues because of COVID and things like that. She stayed at Providence for a couple of days, but because they're just not equipped to have dealt with somebody so small, so new with the virus, that they had to send her to CM in Ann Arbor, the Children's Hospital in Ann Arbor. So they airlifted her. They had to keep her on the heart monitor. They had to keep her on oxygen for a while. And she had to gain some weight before she was able to go home. Then she had to be able to suckle on her own and breathe on her own before she was able to go home. So that's what took the longest for her to be able to go home, because it was just like, for the most part, she was being tube fed and she didn't want to drink on her own. So it was just like, that's what took so long. But the doctors did say that she had some mild kidney damage from the COVID, but they were like, because she's so young, her kidneys are still growing and developing. So she'll, you won't even notice it like once she gets older. And then this is the first day that her dad and my mom got to go see her up in Ann Arbor. It's like, oh, she's still tiny. You want a papaya, Lena? And then I love this one because it's like this little pacifier is about as big as her. And then this one. This is so adorable. This her being this tiny. She got so much attitude now. She gets my nerves. And this is my mom holding her when they first let them see her. So my mom sleep. This is the day they let her go home. I love this picture. It reminds me of like Mr. Burns from The Simpsons. It's adorable. I woke up on the 27th. She had been home like 2 or 3 days. When I came out of the coma, my body was just dead weight. It was like, that's a strange feeling. Just like to feel your body just be dead weight. I couldn't walk. When I came out of the coma, I was paralyzed from the waist down. And what they diagnosed later was Guillain-Barré syndrome. About a week after I came out of the coma, I got feeling and mobility back in the left side, but I didn't have it in the right side. So, and I didn't have it from the knee to the foot. So it finally came back in like the leg, but it didn't come back in the foot. So this is why I have to wear the brace, because there's still no movement in the foot. So we have the brace, so it gives mobility, and strength to the ankle. And that's what we're still working on now. But to go home, I would have to be able to walk. And that took the rest of the time that I was in the hospital, physical therapy twice a day, like 3 hours a day. Even though, like some days I couldn't stand it, but it was just like we had to work towards it. I had a goal. I wanted to be home. I had already missed the first month and a half. I wanted to be home before she was 3 months.
There's just mountains and mountains of blogs and books and websites and publications out there of how to be a mom to a normal baby, or how to be a parent to a normal baby. There is so little information out there and so little publicity and general societal recognition of anything outside of the normal. The kind of parent that you become when your child is early, when your child is immunocompromised, when your child has tubes when your child can't breastfeed, but you're still trying to give them breast milk. It's not really represented and it's not really discussed, and it makes you feel very isolated and kind of like the weird black sheep that no one really wants to talk about. I would pump about 8 times a day at home, and then I would normally be at NICU for 2 or 3 different trips a day. And I would be there for a couple hours and then come back and pump and eat and do whatever, and then be there for a couple hours, come back and pump and do whatever I need to do and go back and forth. Mason had care times that were generally every 3 hours. So every 3 hours I would change her diaper and take her temperature, and we do her blood pressure, switch her pulse ox from one foot to the other foot. Every day at 9-ish in the morning, we'd meet with the doctor. We had 4 different doctors, 2 regulars, and then 2 that were traveling doctors. She had an x-ray almost every day for one thing or another. She lasted almost 2 weeks without having to be intubated. Sure, she was premature, 15 weeks premature, and sure, she was tiny, but her lungs were initially in better shape than what they should have been. And then at about 2 weeks, she had her first really bad episode. Her oxygen decreased significantly, and she lost her color and lost her energy and didn't feel good, and she had to get intubated.
This is the day I got to go home from the hospital. Oh, girl, there's just so many pictures of you in here. This is the very first day I got to hold her. This is the day I came home and I got to meet her. See, look how tiny she was. Oh. This is daddy holding her with just one hand like this. Little cute self. When I came home from the hospital, this whole room was just full of like Amazon boxes, toys, clothes. Like I could have opened up my own baby store. I was very nervous that day because it was just like I had, been building up all this anticipation. I want to be able to hold and walk with her because it was a long period of time where we didn't think that was going to happen. So then when it finally came, I've worked up to this point and now I'm actually going to have to do it. So I was getting nervous. It was like, was I going to be able to be up for this task? She was like 7 pounds by the time I got home, and she was so tiny. At first she fussed a little bit, but then she was just like, I know her. It was just like, oh, amazing. It was like, my little baby. But then it was like, then the fear set in again. It was just like, am I ready for this? The other thing that I was really battling with was the COVID fatigue. It was just like, to walk from my bedroom to the bathroom would just take all of my energy. And it's like, it's as far as from this chair to the door right there. And that's not that far. I just instantly get tired. How am I going to be able to feed every 4 hours or every 2 hours and things like that, and diapers when I can't even keep myself awake? I was glad to have my mom here because, she was able to help me out a lot with that, because it was like, when you've got a screaming baby who's not willing to wait on you, that was kind of hard.
She stayed intubated for I want to say it was 3 weeks. So we got Mason extubated with the Draeger and on CPAP, nasal cannula. And we got so close to her breathing on her own. I was just so overjoyed that we were in a time where I could I could dress her, I could hold her. I was able to move her in and out of her crib by myself. I could kind of like bounce her around. I could give her a bath. It felt like I had a more normal baby.
This was her first outfit. There's something about yellow that I really liked for her, and gray. Gray is normally a color people consider bland, but it always looked really powerful on her somehow. Powerful was like one of the words I kept coming up with when I would describe her. It's crazy something so small can be that powerful. Yeah. But one of my favorites was this one.
We actually were starting to talk about what taking her home is going to look like. And we were talking about that so that Marcus and I can prepare mentally and physically for being, in a way, her next level of nurses. And then the CO2 spiked again.
When we breathe, we're inhaling the gases that surround us. And that gas is filled with 21% oxygen. As a byproduct for all of our metabolic processes, we produce CO2. And when we exhale, the body systems, when they're working normally, are going to get rid of that CO2. So we inhale, we take in oxygen, we exhale, we get rid of CO2. And that remains in balance mostly, unless there's a problem with that gas exchange at a variety of different levels. It could be at the level of the lungs where there's inflammation, so that the barrier between the bloodstream, where the CO2 and the oxygen are being carried around, and the alveoli and the airways in the lungs, if that sort of membrane or if that barrier is thickened by an inflammatory process, it's more difficult for those gases to get back and forth. Another thing that can cause an increased level in CO2 is if you have metabolic processes that are elevated. So you're producing more CO2 than otherwise would keep things in balance. And so I think in Mason's case, it was a combination of both of those, which is not, again, uncommon in a premature baby. With her, she had problems with lung development and an inflammatory process that was keeping the easy transition of gases at the level of the lungs at bay. So that exchange wasn't happening smoothly, or as smoothly as we would have liked it to. And the CO2, the metabolic processes that she was going through were also producing higher levels of CO2. So that just tips the scale in the favor of CO2 and causes, when you check it in the blood, it shows up as an elevated CO2 level. And I think that's what we were seeing in Mason.
I was on the fence about the vaccine at first because it was so new. I was always going to get it, but it was just like, what are the side effects? Can I get a little more information? It's like, buying the first edition of, like a new phone. It was like you wait for them to work out the bugs and then you buy the second edition. We're going into the second wave of the pandemic. It was just like, I've already had it. I've had it the worst. I don't want it again. And it was just like, so, I at some point did plan on getting, vaccinated.
And what about your mom? Where did she stand?
She was on a firm no. I hate to say it, but like a lot of Black people don't want to get vaccinated because, there was a thing called the Tuskegee Project or whatever where they gave a lot of the Black men the syphilis virus or whatever like that. And it just, that is one of the reasons that a lot of Black people don't want to get vaccinated. They're like, well, what are they putting in us? What are they putting in us? But the closer we got to like April and March and April, she was like, okay, well, I'm going to go ahead and get it. I want to say she caught the virus from helping me go to and from my doctor's appointments. I want to say she was in the house about 3 or 4 days when I noticed that, you know, she's got this cough going on. I noticed that like later in the week, the cough was getting really bad. I'm like, well, why don't you go to the doctor? She was like, I don't want to go to the doctor. She's stubborn. She's older. She's stubborn, you know. So she was supposed to have taken me to the doctor, well, went with me to the doctor on the 23rd, but she just wasn't feeling well. When I came back home, she was gone. I called her, she didn't answer. So she called me later on that evening and she was like, oh, I went to urgent care. From urgent care, they sent me to the hospital. I thought she had a stroke because her speech was kind of slurred. She was kind of disoriented. So that's what I'm thinking. That was the 23rd of April. Later on that night, the doctor called, who was on staff for the night. He called and he was just like, you know, I'm sorry to have to inform you, but your mother went into respiratory failure. We've had to place her in the ICU and put her on a ventilator. So the doctor, you know, is calling me every day, you know, everything is fine. The pneumonia that she ended up having, she had it in both lungs, but they were just like, you know, they're getting that under control. They are, her blood pressure was really unstable, but everything else seemed to be fine. At this point, I'm still not, you know, really worried. It was just like, you know, in my mind, it was just like, I fought it, I beat it. But, you know, I'm also not thinking that she's also fought breast cancer, had a double bypass. You know, her body's not as strong or as young as mine. Friday, the doctor calls. Everything is fine. So he normally calls me like in the afternoon, you know, like about 4 or 5 after he's done his rounds and everything. So Saturday morning, the 1st of May, he calls and it's like about 9 in the morning. So I'm already like, what's wrong? He was just like, well, I need you to come in. I'm like, okay. I'm just thinking, I'm not thinking the worst. I'm thinking like, well, you want me to sign some paperwork just in case the worst happens, you know, things like that, just to be on the prepared side. I'm like, okay, no big deal. I'm on my way. I get there and they're like, well, there was nothing else we can do. We just need you to say it's okay for us to turn off the machine. During the night, a blood clot got away from them and they couldn't control it. So, and her blood pressure was too unstable to try to move her to find it. And even if they could find it, they couldn't operate. So the blood clot was due to COVID is what killed her. In my mind, I understood what was going on, but it was just like trying to explain it to my heart. I think by that point, I had already dealt with so much that I was just already numb to everything. She just turned 60. She had made an appointment for the vaccine. She passed away that Saturday on the 1st. We were supposed to go on the 3rd to go and get the vaccine.
She started having seizures, so we did an EEG to look at brain damage, and she had brain damage evident, but it wasn't life-threatening. It wasn't saying that she's going to be on life support or anything like that. She did a second EEG and she was improving. So that told us that the plasticity of her brain was good enough and her health overall was good enough that she can overcome a complication like brain damage to a certain extent. Her life might look different at that point than your average baby, but I mean, she never was gonna be average anyway, so. And we did a lot of skin to skin, so I would get down to, you know, just gym shorts and naked otherwise. And I'd be in this hospital bed that we'd have to roll in and out of our room. We used one of the spare rooms to store it, and we'd have to clear the hallway and roll this thing down and rearrange the entire room. And it would take like 4 to 6 people for me to be able to hold her or put her back. But we did it. And so I'm, you know, almost naked in a bed holding her. And she was asleep. And she was on this shoulder. And it was like a split second. She brought her hand up and she got in between the neo bar and her lips. Her hand actually went into her mouth. And she grabbed the ventilator tube inside her mouth and yanked it out. And the noise. The noise of it was probably the worst because it hurt her and it gagged her and she didn't want it. She grabbed it a second time and just like pulled the whole thing out. Everyone had left the room to give us some space. I looked at Marcus and I just said, yell. And we didn't even bother with, where's the panic button? You don't need a panic button. You just run out the hall and yell. And he ran out the hall and he just said, hey, extubated. And the entire hall went into action. And I went straight to recognizing that we couldn't get her operating table bed back in. There wasn't enough space, so it would take too much time. So we were going to do reintubation in my lab. It took 3 tries to intubate her again. And I felt all of that. It's a metal device that gets pushed to the back of your throat, and it's this clicker to push the tube into you. If it doesn't work, if the person is fighting it too hard, it scratches them and they bleed and they cough. And she's coughing up blood. We had to administer morphine. I felt the moment that hit her bloodstream and her body started to relax. And you don't want that as a parent of a baby, to know they're in so much pain and so much discomfort that they have to be high to get what they need. How do you help? It was very difficult. And that night, Marcus and I came home after staying several more hours there. We came home to get a couple hours of sleep. We got in bed and looked at each other and we said we're never doing that again. Mason didn't want it. She didn't want it. We said that if she extubates again, we're not reintubating. We'll bag and hold until she passes. I went into NICU that night and I just said, I don't want Mason to live a life where she doesn't ever get to feel the wind or go outside or be in the grass or see flowers. And I don't want her to be brain dead. I'd rather her let go of her body than be brain dead. And I told Mason that it was okay if she needed to let go. That I didn't want her to be in pain anymore, but that I couldn't fix her pain. Because at that point we had really fully realized the gas exchange issue, and that was what was slowly killing her. I walked in the NICU that morning on May 14th. I walked in. And it didn't feel heavy. It didn't feel sad. It didn't feel difficult. It just felt like the day she needed to let go. We didn't ask for this to happen, but staff had put together a plan to take her outside for her final time. Well, it was her first time outside, but for her final time in her body. She got extubated. She got everything taken off her, all the tape taken off her face. We got to see her face for the first time with no tape on it and no tubes. And she was very happy about that. And we just did, gas with a little mask. And I sat in a wheelchair and held her. And one of the nurses pushed me. One of the nurses opened all the doors. Another nurse made sure there was no one in the hallway. Another one closed all the blinds for all of NICU because we were going to the courtyard right outside. We all thought she only had like half an hour in her or so after being extubated. So we rushed outside. And she had at least 2 solid hours of breathing on her own. Yeah, and she had just enough pain medication to not feel pain, but to still be there. And she definitely was still there.
There was some clouds. It was sort of partially overcast, but it was a nice summer evening. It was warm enough for us to be outside in shirt sleeves, and there was a pretty large gathering of nurses, doctors, respiratory therapists, people that had been involved in Mason's care that kind of came outside also and circled them. And Mason and Marcus and Leah just sat for a while.
I had asked Marcus, I let it be up to him. Do you want to hold her as she passes? Because he had worked so much. He'd had to work so much so that I could not work, so that I could be there. That, it was the last chance for him. I'd had lots of chances before. And he right away said, yes, I want to hold her as she passes. Yeah. And I don't think you could have found a dry eye in the staff at all, anywhere, at any point. For days.
She had a peaceful death. I think we got to meet everybody's wishes. I think Mason would have wanted that too. Especially of babies that have died, we do hand molds and foot molds, and footprints. So just a kind of a keepsake for the families. And that's one of the things that I've done quite a bit of, and I did for Mason. And I think that process gave me an opportunity to spend time with Mason after she died. And that provides a real sense of closure. You still have some plaster that I dropped on my shoe that's still there that I haven't washed off because it just serves as a reminder. Not only a reminder of Mason, but just just of Leah, Marcus, reminder to do a good job. Reminder that what we do matters, even sometimes when it doesn't feel like it does. One of the greatest experiences of my professional life, just in terms of being able to be part of that. But it was also one of the hardest, for obvious reasons.
Let's give me your sugar. You're about to eat. We got beets everywhere. Talking about no more beets. So I don't like beets. Everybody tells me now the reason why she's so bad now is because I was so evil when I was pregnant. Lena. It's been a long time. Like, I feel like I'm past the COVID fatigue. But yesterday, I just couldn't pull it together. And it was just like, I was just tired the whole day. It was like, the baby's full of energy. She's running around. She's tearing up everything. You should have seen this before you got here. She's tearing up everything, and it's just like, I just can't function. I wrapped up in the blanket and I just laid here in the chair. When I was pregnant, I had gestational diabetes. So that ended up with all the medications that they had me on, that ended up turning into just regular diabetes. And with the COVID latched onto the diabetes and just ran it rampant. The glaucoma came from the diabetes, so I have no vision in the left eye and I have limited vision in the right eye. So pretty much I can just see what's pretty much right in front of me and no peripheral vision. I'm in the percentage of people who want to go back to work. It was like, you can ask anybody at the hospital. That was another one of my goals. I want to be able to walk and hold my baby, and I want to go back to work. That's still one of my goals. I want to go back to work. It's hard trying to find something that I can do. I can't, do security work because it's like, what am I supposed to be able to see? It was like, I can't go back to doing what I was doing before because, it's a safety issue. So as far as working, it was just like, my options are very, very limited. I've applied for state disability, but I've been denied. People need to understand that they need your family support. They need friends support because it's hard. And, I've seen people like, well, my own husband doesn't believe me. My own wife doesn't believe me. People are losing friends and family, because, they're just like, get over it. It was like, well, I can't get over it. I can't function. People aren't making this up. Like, it is very, very difficult to overcome. It's made me very frustrated with people. I just find myself being wanting to stay in my bubble. Just because I have to be, more cautious because I'm a mother now. Now I've got something else, I need to live for and protect. We're not going to live in fear, but we are going to, we're going to live cautiously though, but we're not going to live in fear. People don't want to believe in this virus, and I'm here telling my story because, people need to know.
I try to paint this as a picture of, in the level of the scope of risks of having COVID, that part of the risk is pregnancy complications, reproductive complications, and that I didn't have the vaccine as an option. And now people do. And what's hard is the same people that really like to try to say they're pro-life are the same people that refuse to see this as what I went through as an issue, and refuse the vaccine even though there's just perpetually going to be more pregnancies lost and more babies with health issues the more COVID is around and the more people it infects. And that is really hard to not feel. Like she isn't enough to convince people. That's really hard. I don't wish this on anyone. I really, really don't. I try my best to be as comforted by her legacy as possible. I really think she would want to see people take COVID seriously, and people to see that it takes a village to get things done. It takes a village to beat a disease. It takes a village to get through hardship and struggle.